Welcome to Connective Care and Education. Today we will look at Unit 004, Outcome 2, Health and Wellbeing Children and Young People, Part 4, Factors that may affect children and young people, physical. Let's start by looking at physical factors that can affect an individual's well-being, including genetic inheritance. Just as individuals inherit characteristics such as eye colour from their parents, some medical conditions can be passed on to a child from their parent or parents. These are referred to as genetic or inherited disorders. A genetic disorder arises from the presence of an abnormal gene in an individual's genetic makeup. This may be inherited from one or both parents, but this may not always be the case. For example, Down syndrome. They may also inherit defective genes that give rise to ill health. These include cystic fibrosis, haemophilia, Huntington's disease, sickle cell anemia, muscular dystrophy, thalassemia, Fragile X syndrome, Hunter syndrome. Children with a genetic disorder may miss school due to infections or hospitalisation, and this will affect their intellectual development. Missed opportunities to develop friendships may affect social and emotional development. Where genetic conditions cause digestive problems, physical development may also be affected. Please pause the video here and open 004 Learning Outcome 2 Part 4 Worksheet 1. Once you have completed Worksheet 1, please continue the video. Physical factors that affect health, well-being and development, including disability. Individuals may be born with a disability or may require a disability at any stage of life due to an accident, disease or degeneration of the body due to age. Please pause the video and watch the short film below. There is a link attached. Physical factors that can affect health, well-being and development, including disability. A sensory disability is a disability of the senses, i.e. sight, hearing, smell, touch, taste. There are a number of conditions that will be classed as sensory disabilities, including autism. This is a lifelong developmental disability. Autistic individuals can be highly sensitive to loud noises, bright lights, or being touched. Blindness or poor vision. This can happen from birth or be caused by an accident or as an individual's age. Deafness or hearing loss. This can happen from birth or be caused by an accident or as an individual's age. Anosmia. This is the loss of sense of smell and can be caused by a head injury or infection. Somatosensory impairment. This is the inability to feel heat, pain or light touch. A number of factors including stroke, head injury and cerebral palsy can cause it. Physical factors that affect health, well-being and development include disability. Individuals may be born with a disability or may acquire a disability at any stage of life due to an accident, disease or degeneration of the body due to age. Please pause the video and watch the following short film. There's also a link. Now let's look at physical disabilities. A physical disability is any disability that limits an individual's physical or mobility capacity. It can be caused by disease or accident, but some conditions can be genetic. These include cerebral palsy. This affects movement and coordination. It can also cause speaking and vision problems, and in some cases, learning difficulties. Spina bifida. This is caused when a baby's spine and spinal cord do not develop properly in the womb. It can cause movement problems and paralysis and continence issues. Most children with spina bifida will have normal intelligence. However, a small number may also have some learning disabilities. Multiple sclerosis. This can affect the brain and/or the spinal cord. This can lead to problems with vision and balance and problems with arm and leg movements. It can also affect an individual's ability to think, learn and plan. Muscular dystrophy. This is a muscle wasting disease and gets worse over time. This can cause difficulty walking and issues with breathing and swallowing. Dwarfism. This is characterised by restricted growth and can also cause other problems such as bowed legs or curved spine. Individuals may be born with a disability or may acquire a disability at any stage of life due to an accident, disease, or degeneration of the body due to age. Please pause the video and watch the following short film. There is also a link attached for you. Learning disabilities. A learning disability affects how an individual learns new things throughout their lifetime. These disabilities can be mild, moderate, or profound, severe. Conditions can include Down syndrome. This is caused by an extra chromosomes in the cells and in general is not an inherited disorder. There will be some level of learning disability with this condition. Williams syndrome. This is a rare genetic condition. Children with the syndrome will take longer to learn how to walk, talk, and develop other social skills. It can also cause heart problems. Autism. This is not a learning disability, but individuals with autism will have some level of learning disability. Please pause the video here and open 004 Learning Outcome 2 Part 4 Worksheet 2. Once you have completed Worksheet 2, please continue the video. Now let's look at diet and nutrition. A good diet has a variety of benefits, including increased energy, improved mood, helping to maintain a healthy weight, better sleep quality, clearer skin, and lowers the risk of chronic health conditions such as heart disease, stroke, and cancer. Hydration. The body uses water in all its cells, organs, and tissues. We lose water through breathing, sweating, and digestion. Rehydration replaces the water we lose and has the following important benefits. Helps stop the mouth from being dry, which can cause bad breath. Promotes good cardiovascular health. Helps regulate body temperature. Lubricates joints and helps muscles work more efficiently. Helps the kidneys clear waste from the blood. Breastfeeding. Studies have found that breastfeeding for the first 6 months of life gives a baby the best start in life. The health and developmental benefits for babies include reduces the risk of infection, reduces the risk of diarrhea and vomiting, reduces the risk of SIDS, sudden infant death syndrome, reduces the risk of childhood leukemia, reduces the risk of obesity, and reduces the risk of cardiovascular disease in adulthood. Breastfeeding also has a number of benefits for the mother. It reduces the risk of breast cancer, reduces the risk of ovarian cancer, reduces the risk of osteoporosis or weak bones, reduces the risk of cardiovascular disease, and reduces the risk of obesity. It is recommended that babies who are only given breast milk in the first 6 months of life should also be given a daily supplement of vitamin D. Weaning. In the first 6 months of life, babies will only need breast milk or formula. After this, food should be introduced gradually to prevent the risk of allergies. Foods that need to be introduced one at a time include cow's milk, eggs, foods that contain gluten such as wheat, barley or rye, foods containing nuts and seeds, and fish and shellfish. Physical factors that affect health, well-being and development including physical activity. Being physically active on a daily basis can affect health, development and well-being in a number of positive ways. Children from 0 to 5. Babies, toddlers and nursery-age children should be encouraged to move as much as possible through active play. This will have the following positive effects. Develops movement and coordination, supports learning and social skills, contributes to a healthy weight, enhances bone and muscular development, supports learning of social skills, and improves cardiovascular health. Being physically active on a daily basis can affect health, development and well-being in a number of positive ways. Children 5 to 18. For children to stay healthy, they need to ensure that they do 3 types of activities each week. Aerobic exercise such as playing, chase or swimming. Exercise that strengthens bones such as riding a bike or dancing. Exercise that strengthens muscles such as tree climbing and gymnastics. Exercise at this age will have the following positive benefits. It improves cardiovascular health, maintains a healthy weight, improves bone health, improves self-confidence, and develops new social skills. Please pause the video here and open 004 Learning Outcome 2 Part 4 Worksheet 3. Once you have completed Worksheet 3, please continue the video. Physical factors that can affect health, well-being and development include opportunities for play. Play is essential to the development of babies and children because it contributes to their cognitive, physical, social and emotional well-being. Play promotes brain development and learning in babies and young children. It also decreases the risk of developing health conditions like cardiovascular disease, diabetes and obesity. Outdoor play. Most children will have the ability to run and walk, but they will need to be given the opportunity to practice other skills such as hopping, jumping, throwing and catching. Outdoor play allows them the space to do this. These types of activities will have physical benefits, including improves cardiovascular health, maintains a healthy weight, develops gross motor skills, develops self-confidence, and develops coordination. Indoor play. This can involve more creative and imaginative play, such as painting, playing with jigsaws, and role play. This type of play can have developmental benefits, including improves cognitive skills, improves fine motor skills, promotes mental health, and builds resilience. Factors that affect health, well-being, development include the experience of illness and disease. There are a number of illnesses that can affect a child's growth and development. These include congenital heart defects, asthma, cystic fibrosis, celiac disease, Crohn's disease, and long-term kidney disease. In some cases, growth can be affected either by the illness or by the medications used to treat the illness. This may restrict development opportunities through being unable to partake in physical activities. Pain and frequent visits to the hospital may also affect mental health. Minor illnesses such as tonsillitis, coughs and colds, or diarrhea cause absences from school that can influence a child's intellectual and social development. More serious illnesses such as meningitis and measles, although cured, may leave the individual with a long-term disability such as hearing or vision loss, and in the case of meningitis, loss of limbs. Please pause the video here and open 004 Learning Outcome 2 Part 4 Worksheet 4. Once you have completed Worksheet 4, you have completed the learning aims of 004 Outcome 2 Part 4.